MP Skills Made Easy workshop, and welcome to our differential diagnosis series. Today we're going to talk about dizziness, and this is a common diagnosis in your primary care or outpatient settings. So before we continue with this conversation on dizziness, I want to make sure that you are familiar with a case that would present. This is a typical case in your outpatient setting. So Miss Johnson is a 70-year-old female patient that comes in with episodic dizziness. This case study presents a 70-year-old female patient that comes in experiencing episodic dizziness. And her symptoms are typically triggered by head movements. The patient reports a spinning sensation that occurs intermittently, so it's not there all the time, but it's just something that you definitely want to keep in mind. Here would be the presenting symptoms. So again, episodic dizziness. The patient experiences brief episodes of dizziness. She also has some positional triggers. So again, in her case, the dizziness is triggered by head movements or changes in position. And then, of course, she has the spinning symptom that, again, really bothers her. She does experience a spinning sensation during those episodes. So this will be her HPI. Ms. Johnson experiences episodic vertigo lasting about 30 to 60 seconds, predominantly triggered by head movements such as turning in bed or looking up. So of course there are no associated symptoms of hearing loss or tinnitus, which is ringing in the ears. This will be her past medical history. Of course, you want to make sure you gather a good history for this patient. She has a hypertension, diabetes, hyperlipidemia, and osteoporosis. Of note, you want to really be mindful of this patient in terms of the possible drug interaction. So again, the patient would be on some medication to lower the blood pressure, which can potentially be a differential for dizziness, and of course diabetes, hyperlipidemia, and osteoporosis. So again, as a sound clinician, you want to make sure that you're keeping that in mind, that medication could be, especially optimized hypertensive medications, could be a potential differential diagnosis for this case. And so with the review of system, with the eyes, there are no eye pain, no ear pain or discharge. The cardiac symptoms, no chest pain or palpitations, no respiratory symptoms. And of note would be the neurological symptoms, and really knowing that there are no neurological deficits in this patient. And so again, no sensory loss or no signs of serious underlying conditions. So here in this case, our working diagnosis is benign paroxysmal positional vertigo, so BPPV. You want to know a little bit about BPPV. So BPPV does involve the otolith displacement in the ear canal. Some of the symptoms the patients would typically mention would be that vertigo triggered by head movements. And of course, the best way to diagnose BPPV would be a positive Dix-Hallpike maneuver that confirms peripheral vertigo diagnosis. And so again, it's important for us to kind of talk a little bit about this maneuver assessment. Your Dix-Hallpike is a gold standard diagnostic tool for BPPV. So whenever it is a patient has a positive maneuver, it does indicate BPPV diagnosis through nystagmus. And of course, the patient will have the triggered vertigo whenever we perform the maneuver. And really thinking about that, it really helps you to confirm the diagnosis and hopefully localize which ear is affected, so it could be the right or the left ear. Here will be some differential diagnosis that you want to keep in mind. So your orthostatic hypotension, you always want to consider that in this patient population, your older adult patients. Again, with comorbid factors that this patient has, any patient that comes in with dizziness, lightheadedness, and history of falls, you always want to make sure that you're considering orthostatic hypotension as a diagnosis. Another differential that you definitely want to keep in mind would be your vertebrobasilar insufficiency. Again, with that, you will find that the patient has, more dizziness, continuous vertigo, and a typical nystagmus